Between 1932 and 1972, a chilling medical study unfolded, involving 600 African-American men, 399 of whom had syphilis, but were deliberately denied treatment. Endorsed by medical professionals and academic institutions, including the University of Pennsylvania, this disturbing experiment lasted 4 decades, hidden behind a facade of academic prestige. Today, it stands as one of America's darkest university scandals, a stark betrayal of trust that echoes through history. Our story begins in 1932, at the height of the Great Depression, in Tuskegee, Alabama, a rural community where economic hardship struck the African-American population with unrelenting force. Healthcare was a distant luxury for most, with systemic racism compounding the lack of access to medical care. The U.S. Public Health Service, PHS, in collaboration with Tuskegee Institute, now Tuskegee University, initiated what they misleadingly called a study in nature to observe the progression of untreated syphilis. Presented as a noble pursuit to improve public health, the Tuskegee syphilis study quickly descended into an unethical experiment that violated the most fundamental human rights. The University of Pennsylvania, a prestigious institution with one of the oldest medical schools in the nation, played a complicit role by providing researchers and resources, lending academic credibility to this academic misconduct. At the time, syphilis was a public health crisis, disproportionately affecting marginalized communities. The PHS claimed their study would yield insights to benefit society, but the true cost would be borne by the men of Tuskegee, men whose trust in academic and medical authorities would be irrevocably shattered. This university scandal, driven by rogue professors and institutional negligence, would leave a scar on American academia for generations. The study's foundation was built on deception. The PHS recruited 600 African-American men, primarily impoverished sharecroppers, by promising free healthcare, a rare opportunity in a region where medical services were scarce. But 399 of these men, diagnosed with syphilis, were deliberately denied treatment, even though remedies like salvarsan were available in the 1930s, and penicillin became the standard cure by the 1940s. Instead, participants were told they were being treated for bad blood, a vague local term for various ailments, further obscuring the truth. The men were lured with modest incentives, free meals, periodic medical exams, transportation, and burial insurance, a cruel enticement that exploited their desperate circumstances. The PHS, alongside Tuskegee Institute and Penn's medical researchers, ensured the men remained in the dark about their condition. The true aim was sinister: to document the natural progression of untreated syphilis, allowing the disease to ravage their bodies for observational data, a clear act of academic misconduct that prioritized research over human lives. For 4 decades, the unethical practices continued unabated. When penicillin emerged as a cure in the 1940s, the PHS actively prevented participants from accessing it, even collaborating with local doctors to ensure the men remained untreated. According to James H. Jones in his book, Bad Blood, The Tuskegee Syphilis Experiment, PHS officials went so far as to block participants from being drafted into World War II, where they might have received treatment through military health care. This deliberate exclusion, Jones notes, was a calculated move to preserve the study's control group at the expense of human lives. Syphilis, when untreated, wreaks havoc on the body. The Centers for Disease Control and Prevention, CDC, documents its devastating effects: neurological damage, cardiovascular issues, blindness, dementia, paralysis, and death. Participants suffered immensely as the disease progressed unchecked. Many experienced excruciating pain, with some losing their sight or mobility. Families were also affected. Spouses and children contracted the disease unknowingly, spreading suffering across generations. A 1993 CDC report on the Tuskegee study confirms that at least 28 men died directly from syphilis, with over 100 suffering related complications, though the true toll may be higher. The University of Pennsylvania's role deepened the scandal's impact. Penn's medical school, established in 1765, contributed researchers and resources to the PHS, lending academic legitimacy to the study. According to a 2010 article in the Journal of the History of Medicine and Allied Sciences by Susan M. Reeverby, titled The Tuskegee Syphilis Study and the Politics of Trust in American Medicine, Penn provided medical personnel who conducted examinations and collected data, fully aware of the study's unethical design. These rogue professors, cloaked in academic prestige, betrayed the trust of participants who believed they were receiving care from esteemed institutions. Tuskegee Institute's involvement added another layer of betrayal. As a respected African-American institution, its participation, under the leadership of scholars like Dr. Eugene Dibble, who headed the hospital, encouraged trust among participants. Nurses like Eunice Rivers, who worked closely with the men, further reinforced this trust, often forming personal bonds while concealing the study's true nature. This complicity, Reeverby argues, made the betrayal even more profound, as participants placed their faith in an institution meant to uplift their community. The participants' experiences paint a harrowing picture. Men like Freddie Lee Tyson, one of the study's survivors, later shared their stories during congressional hearings. Tyson recalled painful spinal taps, misleadingly called backshots, which were performed without anesthesia to collect data, not to treat. Another participant, Herman Shaw, testified in 1997 that he trusted the doctors because they were from the government, a trust that was cruelly exploited. These testimonies, documented in the 1973 final report of the Tuskegee Syphilis Study Ad Hoc Advisory Panel, reveal the human cost of this university scandal driven by rogue professors whose academic misconduct left lasting scars. The scandal remained hidden for decades until Peter Buxton, a PHS researcher turned whistleblower, leaked details to the press in 1972. Journalist Jean Heller's exposé, published on July 25, 1972, in the Associated Press and picked up by the New York Times, bore the headline, "Syphilis Victims in U.S. Study Went Untreated for 40 Years." Heller's investigation revealed the study's horrors: men left to die, families torn apart, and academic institutions complicit in the suffering. Public outrage erupted, with civil rights leaders like Reverend Jesse Jackson condemning the study as a genocide experiment rooted in racial injustice. Congressional hearings in 1973, led by Senator Edward Kennedy, uncovered chilling details. The 1973 final report documented how PHS officials, Tuskegee Institute, and Penn's researchers prioritized data over ethics, even as participants died. Survivors and families filed a class action lawsuit, resulting in a $10 million settlement in 1974, though no amount could undo the harm. In 1997, President Bill Clinton issued a formal apology, acknowledging the government's failure. "What was done cannot be undone, but we can end the silence," Clinton said, as reported in a May 16, 1997, New York Times article. For many, the apology came too late. Most participants had already passed away, their lives irrevocably altered by this academic misconduct. The Tuskegee Syphilis Study reshaped ethical standards in research. In response to the scandal, the National Commission for the Protection of Human Subjects of Biomedical and Behavioral Research published the Belmont Report in 1979, establishing principles like informed consent, respect for persons, beneficence, and justice. These reforms, detailed in the Belmont Report, mandated institutional review boards, IRBs, to oversee research, ensuring such atrocities would not recur. The study's impact lingers in African American communities, where deep-seated mistrust of healthcare persists. A 2016 study in the American Journal of Public Health, titled "The Legacy of Tuskegee and Trust in Medical Care," found that African Americans are significantly less likely to participate in medical research due to the scandal's legacy, contributing to ongoing healthcare disparities. This mistrust also influenced vaccine hesitancy, as seen during the COVID-19 pandemic, where historical abuses like Tuskegee were cited as reasons for skepticism, according to a 2021 Journal of the American Medical Association article. The Tuskegee scandal remains a haunting reminder of the dangers of unchecked academic power. It exposes how university scandals, driven by rogue professors, can exploit the most vulnerable, shattering trust in institutions meant to protect. As James H. Jones writes in Bad Blood, the study stands as a symbol of racism in medicine, ethical misconduct in research, and government abuse of the powerless. Penn's complicity underscores the need for ethical vigilance in academia, a lesson that resonates as strongly today as it did in 1972. What can educational institutions do to prevent such university scandals from happening again? How do we balance academic freedom with ethical accountability? Share your thoughts in the comments below. If this deep dive into one of history's most infamous university scandals has intrigued you, like and subscribe for more stories of rogue professors, academic misconduct, and the dark underbelly of higher education. Stay informed, stay vigilant, and let history's lessons guide us toward a more ethical future.